Occipital bone and occipital bone. These bones form the upper part of cranial box, yes, and the base of our cranial form the occipital bone too, the big sphenoid bone, and in the central part of your base, and the frontal bone, and very small bone, but very difficult bone. It is the temporal bone. Temporal bone. It is like this and this. And in our base, we have many holes and canals which have a contact between, for example, between the foramen in cranial part, cranial foramen, the anterior, medial, and posterior cranial fossa, and between this hole, between this canal, through this canal, we have a contact between our brain and, for example, between our orbita, between our nasal cavity, between our oral cavity, and the lateral fossa in our cranial. Through these canals and holes goes nerves, vessels, different, very specific structure. And the first bone, it's the sphenoid bone, and sphenoid bone divided into several parts. The first part, it is the body of this bone, of the central part, and located in
hypophyseal
and have a hypophysis fossa.
or another name also, na? Collateral.
Maybe.
That's the whole region is called collateral.
And the next structure is about lesser wings. Yes,
wings.
or in Latin it is ala minor. Greater wings. In Latin it is ala major. Yes, and the next structure it's about pterygoid process. And the pterygoid process you can see in all cranial. Pterygoid process. Yes. And in sphenoid bone, you can see the different holes and canals. The first canal we can wrote which?
Which one? Sphenoid, no?
Optical canal. This is optical canal. This, and in general canal, this is optical canal. Through which canal we have a contact between a cranial fossa and orbita. The next, fissura orbitalis superior. In a general, this, this, and this, and this. Through this hole goes our 4 cranial nerves, and for example, ophthalmical artery. Ophthalmical, it is the artery which go to your orbital part. The next, it is
foramen rotundum.
Foramen rotundum. This is foramen rotundum. This is foramen rotundum. Next, foramen ovale, 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 and spinosum. Very small hole after in the back position of ovale. This spinosum. This spinosum. And pterygoid. In this preparate, you can see it like this.
Pterygoid.
In the base of the pterygoid process, first of all, you find process, pterygoid, and in the base of this, you can see this canal. In like this, in the anterior position, pterygoid canal, this. In this, in the base part of pterygoid process.
Yes.
Understand this?
Yes,
I repeat. The optical canal, Fissura orbitalis superior, foramen rotundum, foramen ovale, and spinosum, and pterygoid canal. Pterygoid canal. Understand this? Mhm. The next, it is about temporal bone. Our temporal bone consists by 4 parts. The first part, it is the big squama, big squama, from this squama start our zygomatic process. Around this squama located the next part, it is mastoid part or mastoid process. The next, it is the pyramid, and pyramid like a Petrosa part, like a stone pyramid.
And where pyramid?
This.
This one pyramid.
And very small fourth part, it is the tympany part. This is tympany part, very small part, and located under foramen acousticus externus. This is your foramen acousticus extensor, and under this part located this tympanic part. Tympanic part. I repeat: squama part, mastoid part, pyramid or Petrosa part, and tympanic part. 4 part. This bones consist this squama, mastoid, tympanic, and pyramid. The first canal, which is meatus acousticus. Meatus acousticus is the canal, through which canal we can see there are different voices. And this is the foramen acousticus externus. In the back surface of pyramid located the foramen acousticus internus. The next.
Canalis caroticus.
Canalis caroticus. It's the canal through which goes our very big artery, caroticus internus artery, which gives many small vessels to your brain, which is very big artery. And this artery goes through your neck and goes there to the foramen caroticus externus. This is foramen caroticus externus. In a general, foramen caroticus externus. And after, this artery goes in the through the neck, goes from this hole, and after do the angulus, and located in a pyramid part, and after enter to the foramen caroticus internus, this is, and divided into many vessels and gives the blood to your brain. This artery goes through your neck to the external carotid foramen. After do this angulus and enter in your inner structure of cranium and gives many vessels to your brain. I repeat: foramen caroticus externus, and this is foramen caroticus internus. The next,
Facial canal.
facial canal. Start in the foramen acousticus internus, foramen acousticus internus, foramen caroticus internus, or acousticus internus, and ended in stylomastoid foramen. This is stylomastoid foramen. Stylomastoid, between mastoid
Mastoid
process and styloid
styloid
process.
process.
In this cranial, we don't have a styloid because it is the fracture, have a fracture. Styloid process, or styloid
styloid.
process and
styloid.
mastoid.
Mastoid process.
Between this, we have
Foramen.
this foramen,
Stylomastoid.
stylomastoid
Stylomastoid
foramen.
foramen.
And our facial canal, I repeat, start in foramen acousticus internus and ended in stylomastoid foramen. The next,
Fissura petrotympanicum.
fissura petrotympanica and petrosquamosa. In this, you can see, in a red pencil I do this. This is two fissures.
Fissure.
Fissure.
Fissura.
Fissura. In Latin, fissura. Petrotympanica. Petrosquamosa. It means that petrotympanica, the fissure, which located between petro part and squama part. Petrotympanica, between petro part and tympanica part. Petro, it is about pyramid. This is petro. Tympanica, it is the tympany part. Petro squamosa, it is around the squama part. Petro tympanica, it's the fissure which close to the tympany. Petro squamosa, it's fissure close to the squama part. Petro tympanica and petro squamosa. You can see between these two very thin fissures located the bone, very small bone. You can see it.
Yes.
Fissura petrotympanica, fissura petrosquamosa. It is very important fissures between because in one of these located very powerful nerve, for example, chorda tympani, which innervated your tongue. And some patients will come to you with a pain in your tongue. And if you don't understand which nerve innervated this tongue, you can't answer his questions, for example. And the canal, it is chorda tympani. Start in a stylomastoid foramen and ended one of these fissure petrotympanica. Yes. The next. Musculotubarius. You find these fissures, and under all these fissures located this canal. In this cranium, these fissures, this fissure, and under all this fissure located this canal.
Yes.
Understand?
Yes.
Please find this canal themselves. Try to this, please. Now